Welcome back to Pharmacy House, your go-to channel for all things pharmacy related. In this video, we're going to dive into the tips and strategies to pass the Pharmacy Oral Exam Part B, which is legal and ethical practice. We've gathered insights from past examiners, preceptors, and industry experts to give you the best chance of success in this section. Today, we'll be focusing on a scenario where you, as the pharmacist, encounter a situation involving a regular customer seeking to refill a prescription for Panadeine Forte. However, upon reviewing the prescription, you discover that it was written by a doctor who is no longer practicing medicine, and the prescription is also past its expiration date. The customer insists on an urgent refill, pleading with you to proceed. So, what should you do in this situation? When tackling this question in the exam, remember that you'll have 5 minutes to answer and your time starts as soon as the examiners hand you the scenario. Examiners may also ask you additional questions during this time, as these 5 minutes are structured as a discussion rather than a monologue. Let's break down the recommended approach to answering this scenario. The examiners will assess you based on your knowledge of ethical and legal aspects, your ability to apply that knowledge, your decision-making proficiency, and your communication skills. It's important to clearly explain the relevant issues, justify your actions, and provide a satisfactory outcome for the patient or situation described. Also, make sure you have a structured approach ready to go. For example, identify issues, explain consequences, identify stakeholders, and then reach a conclusion. So, let's begin by identifying the legal and ethical issues at play. In this case, it is both unethical and illegal to dispense a prescription that is expired. The consequences of doing so can range from patient harm to legal ramifications for both the pharmacist and the pharmacy. Now, how can we best handle this situation? In this scenario, my approach would involve empathetic communication and prioritizing patient safety. Firstly, I would explain to the patient the reasons behind not being able to dispense an expired prescription, such as to ensure their efficacy and safe use. Next, I would empathize with the patient's pain and understand their urgency. I would assure them that I'm committed to finding a suitable solution. Since the doctor who wrote the prescription is no longer practicing, I would offer assistance in booking an appointment with another doctor. This way, they can obtain a new prescription, if necessary, and discuss their medication needs in detail. Furthermore, I would engage in a conversation with the patient to understand their specific medical condition and explore non-prescription alternatives. This could involve suggesting over-the-counter medications or discussing non-pharmacological approaches to manage their symptoms. It's important to ensure that the patient is aware of all available options. Lastly, I would emphasize the legal and ethical implications of dispensing an expired prescription. I would explain that doing so would be illegal and could have serious consequences, including the risk of losing my registration as a pharmacist. Additionally, I would highlight that using an expired prescription may not be the best and most appropriate medication for the patient anymore, potentially causing harm. By taking these steps, I would aim to address the patient's concerns, provide appropriate guidance, and ensure their safety while adhering to legal and ethical standards. Refer to credible documents where possible. For example, the PSA Code of Ethics Integrity Principle 1 says, "A pharmacist should act with honesty and integrity to maintain public trust and confidence in the profession." If I dispense an expired script, not only is it illegal but would break that public trust. The PSA Code sits within a broader hierarchy of guidance underpinning and supporting the practice of pharmacists. It is important to emphasize that pharmacists must fulfill legal obligations at all times, and that no part of the PSA Code must be interpreted as permitting a breach of the law or discouraging compliance with legal requirements. Now, don't forget that the examiners can ask you questions like, what would you do in the future to ensure something like this doesn't happen again? It is essential to educate patients about prescription expiration dates to prevent them from attempting to fill an expired script and ensure their overall safety and well-being. By informing patients about the significance of expiration dates, we can increase patient safety. Educating patients helps them understand that using expired prescriptions may not provide the best care, as there may now be better options available for them. Also, by educating patients about prescription expiration dates, We enable them to seek timely refills, ensuring they receive the full benefit of their prescribed medication when it is most appropriate. Remember, it's crucial to understand the legal and ethical considerations, justify your actions, and communicate clearly throughout your response. By following these steps and incorporating the key elements we discussed, you'll be well prepared to tackle this section of the pharmacy oral exam. Good luck, and don't forget to subscribe to Pharmacy House Australia for more videos. Let us know in the comments below what topic you'd like to see next.